Many vulnerable people groups from marginalized and hard-to-reach areas face significant barriers to quality healthcare and cannot exercise their rights regarding their health. This, in turn, affects their quality of life as it limits their potential significantly. This is Turkana County in the northern part of Kenya, an expansive semi-arid region with minimal infrastructural development. Water and food are scarce commodities due to the prolonged droughts here. Residents depend majorly on livestock for their livelihood. But with little to no rainfall, that too is no longer tenable. Poverty coupled with harmful cultural practices have seen underage girls given out in marriage, denying them their rights like access to education. Many others have equally had to cut short their education due to the high rate of unintended pregnancies.
Majina yangu ni Alice Akitenglajao from Kalobe. Nilikuwa class 7, nikapachikwa mimba, nikazaa mtoto. Mtoto akawa mkubwa, nikaenda shule. Kufika form 2 term 2. And then tena nikapata mimba ya pili. Then hapo sasa ndio nikaamua nikakaa nyumbani. Sasa mwanangu ako shule university, mimi ndio niko nyumbani. Kuna wasichana hapa wengi hawajamaliza shule, wameacha. Wengine juu ya ujauzito, wengine juu ya umaskini.
And for the many who are still in school, it might just be a matter of time before they bow out due to many other challenges, including hunger.
Niko darasa la 3. Vile naishi, ukirudi shule, huyu mama yangu hakuna hata kitu nini. Unakuja tu, unalala njaa. Halafu unaenda shule hivyo. Hivi tu tunakaa, hakuna hata kitu tunakula. Hii boma naomba watoto hii boma na nini. Badis ananisaidia. Kama hakuna unatafuta crack ndio unatumia. Ningependa nikuwa mkubwa na kuwa nini na kuwa madam.
Turkana West Sub-County is also host to thousands of refugees, most of whom face similar challenges as the host community. Culture has been the greatest barrier to the enjoyment of health-related rights for most children and youth in the resettlement camps.
I am Michael Oloya, a South Sudanese refugee living in Kalobe, Village 1, which is under Kakuma refugee camp. I came here in 2016. Our youth as South Sudanese, and even let me say include the host community, which are the Turkana, they are fully believe in the issue of early marriage, which they look into it as a normal thing. And in fact, for them, they believe if a girl reaches in the age of 15, 14, that is a good age of getting married. And if you pass the age of 15, you will reach about 20, 21, and there it will be very difficult for you to have a husband. So this affected our community in a way that it denied them a right of education, it denied them a right of enjoying the life of being a youth, and it has limited them from doing other things which they would have done better.
Adventist Development and Relief Agency, Adra, a non-governmental organization, is keen on changing this narrative in Turkana. In the year 2021, Adra, with funding from Global Affairs Canada, launched the Uniting Towards Gender Equality for the Enjoyment of Women's and Girls' Total Health and Rights program in Turkana West Sub-County.
One of the intervention of Together project is increasing knowledge of adolescent girls to enable them advocate for their sexual reproductive health rights. We are training them on life skills on 21st century, where they are taken through some topics, one being stress management, HIV and AIDS, self-esteem, and many others.
For me, I'm positive about the training. It was good. it really changed my life. Kuna vitu mingi tulifunzwa kwa life skills, how you're going to protect yourself, how you're going to raise your children as a parent. Kwanza hiyo mostly parent nilichukulia kwa sababu walikuwa wanasema ukuwe na wakati wako na mtoto wako. Umongeleshe mtoto wako, unakuwa na hiyo parental responsibility. You're supposed to know wakati mtoto wako ni mgonjwa, ako happy, hayuko happy, unafaa kujua. So that wakati atakuwa amefikia hizo challenge, wewe ni rafiki yake wa kwanza, wewe ni mwalimu wake wa kwanza.
Kawaida sikuwa najua kama mwanamke anaweza repiwa na mume wake na inaweza kuwa ni dhulma. Nilikuwa nafikiria ni kitu normal, lakini saa hii mafunzo imenionyesha niko na right yangu kama mwanamke, ile wakati si feel kufanya anything like mapenzi niachwe mpaka ile time ni akili yangu itakuwa set.
Rape issue is a key concern, and we really realize that at community level it is swept under the ground. It happens in the community, it's not reported, and it is sorted out at community level. So the victims are affected, nobody is there to counsel them, and then they end up now suffering silently, not speaking up, not reporting, and it ends up dying that way.
When this Together project, through the help of Adra, they came in, and me getting involved in this project has opened our eyes, since we have been trained on how to identify issues which are affecting our young youth, even the community at large. This problem, we found the high rate of early marriage in the community, and there is rape cases in the community, and these young youths are also get involved in the drugs abuse in the community.
From the knowledge Michael received, he's been able to train 25 other young people in his village. He is among a group of beneficiaries that Adra has trained and equipped to train other members within their respective villages.
Tunafundisha vijana kwa wasichana kuanzia 14 years mpaka 24 years.
Martha, a village elder, is one of the many duty bearers trained by Adra who are now utilizing community-led, evidence-based multi-sectoral approaches in reducing structural barriers, preventing the realization of health-related rights.
Tunafundisha maneno ya early pregnancies, early marriages, rape na drug abuse. Na hii mafundisho imewafungua mawazo. Hata wazazi wanafunzi ama watoto wana appreciate sana. Kuna wale walikuwa kwa drug abuse sana. Wengine wameanza kupunguza, wengine wameacha kabisa.
We are determined to reach out to 24,000 beneficiaries who will directly benefit from the project. And we are focusing to have around 500 educators to reach out to these people in the community. So far, more than 2,000 adolescent boys and girls, young women and men have been reached out with these messages.
Tulipofunzwa juu ya life skills, tuliweza kurudi shule. Wengine wetu, kwanza mimi nilikuwa nimekataa shule kabisa, lakini wakati Adra ilileta mafunzo yake, niliweza kurudi shule na hakika sasa ninaendelea. Na wengi wetu ambayo wamefunzwa wameweza kuenda kusomea makosi mbalimbali. Kuna wengine wameenda polytechnic, wengine wameenda Don Bosco kusomea plumbing.
This year nimeona different since wakati Adra alikuja akaanza kufunza hawa watoto. Nimeona watoto by this time wanachelewanga kwenda shule, but I'm seeing the changes that they are promoted already in the school.
All those duty bearers, we advocate for implementation of sexual reproductive health rights and sexual gender-based violence policies. So far we've done 4 advocacy forums. We are targeting 40, and the response so far has been good.
My colleagues plus myself, we've been trained on many occasions, especially life skills. So, and I think Adra's training, especially the trainings that are ongoing in the community, they are assisting mainly with sensitization. This whole time that I've been here, it is this year, if not in December, that I saw someone come in for a swab after being raped, you see. So usually a lot goes on in the community, but like walking out is a bit difficult. So I think with the sensitization in the community, people, and mobilization, people are slowly getting to understand that actually this is not something which is right for me to be raped, and after it happens, I get services. There are these services that I can get from the hospital, so they are coming.
Adra ingekuwa imenifunza kitambo, singeweza kuwa sahihi maisha. Nimefunzwa mambo ya lishe bora kwa watoto, yani a balanced diet. Ningependa kusema Adra ituongezee walimu, wapeleko nje ya Kalobeye ili wafunze watu wengine.
I think what we are expecting to see is increased number of women utilizing modern family planning services, increased number of children back in school, reduced teenage pregnancies, reduced early marriages. And we also are anticipating to see accessible healthcare services. We want to see a workforce that is well trained and able to provide sexual reproductive health care services to the mothers, as well as quality services to the survivors of gender-based violence.